Hello, my name is Rick Spade. I'm going to be talking about choriocapillaris vascular parameters in normal eyes and those with pachychoroid with and without disease. These are my disclosures. Pachychoroid is really an incomplete and poorly defined entity. A recent literature review that's going to appear in the journal Retina looked at pachychoroid and pachychoroid spectrum diseases. Just for pachychoroid, there were 44 papers. 19 of those papers had no definition of what pachychoroid was, and the remaining 25 papers had 18 different definitions. What about other causes of thick choroid? After all, pachychoroid means thick choroid, but only includes a minority of things that actually have a thick choroid. Here's a list of many different entities that cause choroidal thickening that aren't included in the pachychoroid spectrum. Here's another big list of things that cause thickening of the choroid that aren't included in the pachychoroid spectrum. Well, to compound things, or these difficulties, pachychoroid was the definition of which was expanded. And people said, well, a choroid doesn't have to be thick to have pachychoroid, even though the word pachychoroid means thick choroid. But it did say that choroidal vascular hyperpermeability was important. Not necessarily, just important. Well, here's a number of different entities that cause choroidal vascular hyperpermeability that aren't included in the pachychoroid spectrum. Here are another series of disease entities that cause choroidal vascular hyperpermeability but aren't included in the pachychoroid spectrum. So the pachychoroid spectrum really is kind of arbitrary in what it includes and what it excludes. It doesn't have really that much clinical utility because the thickening of the choroid is really an epiphenomenon, and it's not even required in the first place to fulfill a definition of the disease. But there are people with a thick choroid, and it's kind of interesting to know what's up with those patients. Are they any different in any sort of way? So to investigate that, I did a study of patients and looked at their choriocapillaris. And I looked at normals. I looked at patients who had a thick choroid defined by population standards. So what I looked for is those people with 95th percentile thickness or greater on an age-adjusted basis. And to come up with that age-adjusted amount, I looked at older studies and picked out the upper fifth percentile in terms of choroidal thickness. And the regression equation for that was that the choroidal thickness in microns for the upper 5% was 525 minus 3.25 times the age. So there were three groups of patients examined in this study: those with normal choroids, those with the pachychoroid with no disease, that's the upper 95 percentile or more, and pachychoroid disease, still using the word pachychoroid just for historical reasons, which included patients with central serous or peripapillary pachychoroid syndrome. Those patients, by the way, also had a thick choroid. I used a technique that I devised and published in which we make a sandwich out of three different layers of the retina: the superficial vascular plexus, the choriocapillaris, and the deep vascular plexus are each put into one channel of a red-green-blue color channel picture, and that makes a composite picture. That picture may look a little strange to us, but it gives the computer something to latch onto to register and average these images. After that, you get an averaged image, and you can split them back into the component parts, and you end up with an average choriocapillaris image. Here's a choriocapillaris of a normal 27-year-old. You can see that the pattern of the choriocapillaris looks very much like histology pictures. Now we can binarize that into a white and black and white image, as I showed here. You can compare that also to a 66-year-old with central serous, and you can see not only are there areas where the blood vessels aren't, those would be flow deficits, but the capillaries themselves look different. So that we can analyze this. Once you end up with a binarized version of the choriocapillaris, we can skeletonize that, and you can overlay that on top of the skeletonized version on top of the binarized version. You can see it's quite accurate. And from that, we can either measure or calculate a number of different parameters about the vascularity in the choriocapillaris. We can count how many blood vessels there are per square millimeter, for instance, or measure the mean branch length or the standard deviation of these branches. So let's look at these three different disease groups: normal, pachychoroid without disease, and this special group, pachychoroid with disease, that is central serous and peripapillary pachychoroid syndrome. So normal and pachychoroid without disease were essentially the same for every vascular parameter. That includes mean vascular length, the branch standard deviation, number of branches per square millimeter, the diameter of the branches, and the fractal dimension. Whereas pachychoroid disease was distinctly different from both of those. In particular, the branch length was longer in pachychoroid disease, the standard deviation was greater, the number of vessels per square millimeter was less, vascular diameter was greater, and the fractal dimension was less. So, among the choriocapillaris parameters, the people who were normal controls and 95th percentile choroidal thickness with no obvious disease, same. The people, though, with disease, central serous chorioretinopathy or peripapillary pachychoroid syndrome, had a marked difference in their capillaries. This new pachychoroid study shows that increased choroidal thickness is not necessarily pathologic. And we can make an analogy to intraocular pressure over greater than 21 millimeters mercury, in which not everyone over that pressure gets glaucoma. In fact, only a minority of people do. By definition, 5% of the population will have a pachychoroid by this definition, but it illustrates that they don't necessarily have any disease or any problem. It's the first study to measure choriocapillaris parameters in health or disease, defined pachychoroid according to an age-adjusted thickness as opposed to some arbitrary definition, and by doing so allows greater precision in disease definition and understanding.